Hello, my name is John James. I'm the Director of Public Health and Disaster Services at the Palm Beach County Medical Society. And as always, I appreciate the opportunity to speak to you all. A little bit about me. I was born and raised right here in Palm Beach County. I went to Atlantic High School many years ago. I left there to attend the University of Florida, where I received a degree in economics. I began my professional career at the Home Depot, where I worked in management for about 12 years. I then spent a few years working for Cemex, which is a construction company. And in 2009, I decided to go back to school, where I earned my master's in health administration from FAU, which helped me obtain this position, which I've been doing now for 10 years. So what does my position of Director in Public Health and Disaster Services entail? In short, I work in the healthcare sector, but instead of providing direct care to patients, my impact is felt more on a communal scale, as I oversee two programs that assist in strengthening the emergency preparedness efforts of Palm Beach County. One of the programs is called the Medical Reserve Corps, or MRC. So what is the MRC? It is a network of medical and non-medical folks who want to donate their time and expertise to train, prepare, and respond to disasters or public health emergencies. They are doctors, nurses, pharmacists, mental health professionals, essentially people from all walks of life. The MRC was created in 2002 during President Bush's State of the Union address, in which he asked all Americans to volunteer in support of their country. The need for trained health and medical personnel to assist with emergency operation was highlighted after the terrorist attacks of 9/11. Many people responded and wanted to offer support, but there was no organized structure in place. The MRC provides this structure, and the goal is to augment or support the healthcare system, not replace it. And during the peak of COVID-19, dozens of nurses and doctors provided well care and volunteered their time and expertise at our vaccination sites here in Palm Beach County. I also oversee a program called the Healthcare Emergency Response Coalition, otherwise known as HERC. HERC is a network of acute and subacute care hospitals, first responders, the Department of Health, Emergency Management, and many other partners who come together to plan, train, exercise, and respond to disasters and public health events. A disaster is any event that causes massive damage or loss of life. It could be a hurricane, a train derailment, active shooter event, or a pandemic. They come in many forms. So on a typical day, which is what we call blue skies, we create plans. And for example, we're currently in the midst of creating a countywide burn plan. This plan will provide guidance for our hospitals, our EMS agencies, and other agencies in the event we have a burn mass casualty incident in which the number and severity of burn patients greatly exceeds our county's capability to care for them. We also exercise. We do tons of exercises. We conduct active shooter exercises, biological exercises like anthrax or Ebola, radiological exercises. Exercises gets us prepared for when a real world event does occur, we can perform at our best. Next, I want to provide you with a couple of preparedness tips. As most of you know, hurricane season begins June 1st and runs through November 30th. So we should begin preparing late May, early June. You should know if you live in an evacuation zone. If your resident is prone to flooding on a typical rainy Tuesday, what will your home look like 3 to 4 days of tropical weather? If you go to www.readypbc.org, scroll down and put your home address, it will show if you reside in an evacuation zone. If you do have to evacuate, the plan is to relocate miles, not hundreds of miles. The phrase is run from the water, hide from the wind. Most deaths that occur during hurricanes are due to drowning, not so much the wind. That's why emphasis is placed on evacuating if you live in a floodplain area. So I encourage you all to share this website with your parents or guardians. You should also have a hurricane kit prepared with flashlights, batteries, a first aid kit, 5 gallons of water per person per day, phone chargers, etc. And these should be stored in a bin or in a closet, so when the storm is pending, you and your families can focus on other necessities like gas and food. Also, I encourage you to follow the National Weather Services on Twitter. They'll provide you with some critical updates, charts, and helpful information before and during a storm. Let's segue to active shooter events. Your schools have this part under control as they go into lockdown mode. But what if you're at the mall or a concert or a place of worship? You should always know your entry and your exit points. And you should always be aware of your surroundings. If you happen to see something that doesn't make sense, say something. There's a tip line that you can call to report suspicious activity. And that number is 855-FLA-SAFE. That's 855-FLA-SAFE. Now let's talk salary and benefits. The entry-level position in this field would be about $50,000 to $65,000 per year, with potential earnings into six figures, especially if you're working in a corporate setting. Typical work schedule is 8 to 5, Monday through Friday, and depending on your employer, it could be virtual some days. Typically, you're off on the weekends and major holidays, but because this is disaster preparedness, you're essentially available 24 hours a day, 7 days a week. You also have a comprehensive benefit package with medical, dental, vision, and 401k. Disaster preparedness is very rewarding as you're constantly learning new things, new ideas, new plans and protocols that will help prepare and keep your community safe. Lastly, there are many resources at your disposal to help guide you. Scholarships, grants, organizations like the T. Leroy Jefferson Medical Society, and many more that can provide assistance. At the end of the day, follow your passion. If you love what you do, you'll get very good at it. And if you're very good at something, the money will follow. If you have any questions about anything I've discussed, or you're looking for resources, I can be reached at johnj@pbcms.org. Thank you, and I wish you all the best in your studies.